see first of all, what is pancreatitis? As the word speaks for itself, pancreatitis means inflammation of the pancreas. But the special characteristic of the disease is it is a progressive disease. Once there's a pancreatitis, it never goes back, it keeps on progressing. And that's why there's a significant mortality is associated with the disease. And the first case of pancreatitis came in the world in 1682, where a Brazilian in Brazil, where a Dutch anatomist identified it. And in India, the first case was identified in 1937. But you can see that by 2015, the world has seen the upsurge of annual pancreatitis patient with the tone of 8.9 million cases globally in that year. And besides, the number of cases are increasing, but the mortality is increasing. There is a study published which says that 55% people survive for 20 years in a country like the United States. And the disease, while it has so many things, it affects physical state, mental state, financial state, social state. So it is a big burden to the people. Now the question comes, what is very special about this pancreatitis? The pancreatitis inflamed of the pancreas stop the flow of enzymes from the pancreas, which is essential for the digestion. And when these enzymes are within the pancreas, it develops autophagy, means self-destruction of tissues. So patient may start losing weight, and patient may start feeling poor digestion. So these are the miseries related to that. And broadly, pancreatitis can be classified into two forms, acute and chronic. Acute means a patient may have history of disease for 5 years with many attacks, but it can remain acute because there is only inflammation. But a patient can be a chronic patient without any attack because it is distinguished by the structural changes which can be seen in the images like ultrasound, MRI, CT scan. So this is very important to know because many people feel that acute means sudden and chronic means old. But in this category of disease, acute and chronic can be from the day one and acute can be for 5 years or maybe more. So the diagnosis of the pancreatitis is very crucial. It is not an easy diagnosis. So diagnosis should be made by a competent gastroenterologist who is not only well versed with the diagnosis of pancreatitis, but he or she is well versed with the other disorder of GIT. And it is not a clinical diagnosis. It is based on images. It is based on ultrasound, CT scan, MRI. The ERCP is an invasive test and MRCP is a non-invasive test. And the worldwide, MRCP is considered to be the most safe and easy way to understand the diagnosis and to note the progression and regression in any case.